Okay, so I have two things that I am terribly passionate about, and I want to take just a few minutes of your time and really see if I can grab you in and get you passionate about it too. The first is that animals experience chronic pain just like humans do. It is an epidemic in our human healthcare, and it's an epidemic in the canine and feline world as well. And acupuncture is a non-invasive treatment modality that's available for the treatment of chronic pain for small animals. The pet's role in the family has changed so much in the last 20 years. Our pets are now full-fledged members of our family. Owners are attached by a leash as well as a heartstring, and so that makes our lives so much better as veterinarians. No longer does the dog sleep on the porch. Heck, the dog doesn't even sleep on the floor anymore. The dog is right on the bed next to the cat, and the humans are struggling to find a spot to sleep. And as the human and animal bond has evolved and changed, so has veterinary medicine. Veterinarians are now considered the family's other doctor. We are trusted to provide the highest standard of care to keep your pets happy and healthy for a long time. And as a side effect, we've actually been successful, and as a result, pets are living longer and happier lives. But there is one unfortunate part to pet ownership. The sad thing is aside from an occasional chewed up pair of shoes, is that pets very rarely outlive us. And as owners, we see our pets age, and we notice that they age so much faster than we do. And unfortunately, their chronic diseases seem to also be a little bit more obvious to us as they get older. And chronic pain is one of those diseases that an aging pet's going to have to cope with. And in contrast to humans, most affected pets will carry on and take care of their people without much complaint. We have many Western modalities that treat chronic pain. We do. But unfortunately, all of these options come with pretty obvious shortcomings, especially in a geriatric patient. They may not be able to handle the side effects of drugs or surgery, and so a complementary approach should be considered in pets that have chronic pain to help them enjoy the rest of their life. And one of those options I offer pretty much every day is acupuncture. So what is acupuncture? Essentially, it comes from the Latin root words acus, which means needle, and punctura, which means to penetrate. So therefore, by way of definition, it's putting a needle into the skin. Pretty straightforward. The needles are really small. I promise they are. Everyone asks me, does that hurt? No, it doesn't. They're about the size of a few human hairs. And it's amazing because you just see them go into the skin and you think, oh, that's no big deal. But what's going on below the skin is going to be what you see essentially affecting your pet in the long run. So you have to think to yourself, treating pain with pain. How novel, how innovative, and how the heck does that work? Well, there is no one easy mechanism to explain the effects of acupuncture. People have been trying to do it for 3,000 years now, so it's not an easy thing to come by. But I'm going to try to attempt to explain it in a very simple way. So when we're dealing with pain, we have to know that's the brain and the spinal cord that are responsible for the pain experience, as well as being on the hook for the treatment of it. So in order to understand this concept, I'm going to transport you to your kitchen. And you are making dinner, you're cutting up a tomato, and the spaghetti water is boiling over, the bread is burning, you're late. All of those things are going on, and bam, you cut your finger. Within milliseconds, your brain gets a message from the hand saying, hello, there's injury here. Brain then does its job and says, that hurts like the dickens. So the brain is very self-centered, and we'll talk a little bit about the brain. I have a lot of respect for it, but it just cares about itself, and it also cares about the body, which is its vessel. So essentially, it's going to give you a nice, consistent response. So the first thing that's going to happen, and most people, and I'm sorry, you will swear. It may be on the inside of your brain. Some people like me have it come out of said brain, but it will happen because it's just a response. Then you will remove your hand from the knife or the knife from your hand, whichever is faster, and you will grab your finger and squeeze. Now, all of a sudden, you have relief from that first initial pain. It doesn't hurt near as much because you're squeezing the dickens out of your hand. Well, I'm going to oversimplify, and the nervous system is infinitely complex, but it does have some significant simplicity. One concept: the brain can only deal with one pain signal at a time. It's not a great multitasker. For everyone texting and walking, you're not going to do a great job at that. So when you cut your finger, you have signal transmitted to the brain by way of a fast nociceptive fiber. It's a fast fiber because its job is to keep you safe, if it's even from yourself. The automatic withdrawal is a reflex, so it's going to happen no matter how hard you try. Your hand's going to be removed, and in a hurry, your brain is working. It wants to downregulate that pain with its internal pharmacy, and you have to know this internal pharmacy is by far and away better than anything you'll get from Walgreens. So when you grab and you squeeze your cut finger, all of a sudden a new signal is transmitted to the brain. And this is by way of mechanoreceptors, and this signal bombards the brain with an entirely different, non-painful pressure input. So since the brain can only deal with one pain signal at a time, one of the signals needs to be ignored. That's your spinal cord's job. It essentially needs to stop one signal and let the other signal pass by. In this case, the signal that stops is the slower of the two, and quite frankly, it's the nociceptive pain. So now, all of a sudden, this really sharp pain fiber is being shut down, the pressure fiber is being allowed to function on your brain, and it gives your brain time to down-regulate the pain, and so that way you can go find a Band-Aid, calm down, stop swearing, and go about your day, and you don't experience that first pain again. This concept was theorized in 1965, and it's known as the Gait theory. And the Gait theory basically says that one pain signal on its way to the brain can potentially turn off another pain signal. It's fairly simple. So when it comes to the treatment of chronic pain, it's through the Gait theory that my skeptical brain understands how acupuncture works. Chronic pain, much different than acute pain. Totally different ballgame, has no survival advantage. If you are in chronic pain, it's not going to help the lion catch the prey's not going to get away any faster because, hey, chronic pain is not normal. It's a pathologic process, it's a disease. It's a pain that's lost its meaning. It's no longer specific, it's no longer sensitive, and it's actually not evolutionarily appropriate. So it's very difficult for our nervous systems to manage it. So most of the fibers that are involved with chronic pain are thick, slow fibers, which is why you feel different pain. So cutting your finger is a sharp, ouch pain. The backache that you have at the end of the day after you've looked over your computer all day is a slow aching pain. So those are two very different nerve fibers that are involved. So how does acupuncture exploit the Gait theory? So essentially, acupuncture points are anatomic sites that are richly supplied with nerve endings. So when I stick a needle into the point that's primed and ready for neural input, yes, I'm going to cause a reaction in the brain. There's no way around it. And as the needle is inserted and rotated, collagen and elastin fibers are going to stick right on it, and it's going to couple between the tissues and twist. And then you're going to get a coupling between the tissue and the metal. And what that does is it causes microinflammation. The needles are very small. You can see the little blue point on, that's just the end. It just helps it so I can find them when they fall on the floor. And then I will gently put it into Miss Lucy, who's got some chronic arthritis in her hips and her shoulders. And she says, "Hello, I'm so happy." And she's going to go back to eating her frozen baby food, which is a great distraction for most dogs when I'm needling them. Anyway, so after I put this needle in, you're going to get this coupling with the tissues, and there's going to be this microinflammation and micro pull on nerve endings and irritation of muscle fibers. And oh my God, that sounds awful. It's like I'm doing a terrible thing. But when I do this with a small little microscopic inflammatory response, I am going to activate which fiber? First fibers. First pain. Much faster than those slow chronic pain fibers. So they're basically going to shut the gate. And so the brain is going to listen to the faster of the two fibers, as well as the evolutionarily appropriate pain. So that actually allows for the brain to activate its neurochemical pharmacy and start to down-regulate pain very quickly. And this pharmacy is filled with opioids and serotonin and endorphins, and so it makes them feel so good. And this resultant effect is known as neuromodulation, and that's the way that acupuncture is known to have an influence on our body. In addition, because pain is an experience, and as you can see, when Lucy was in the video, she didn't look too unhappy, did she? She's pretty happy. And so we know that pain is linked to many a memory. Everyone's had a broken heart or a broken bone, so we all remember that. Acupuncture exploits that as well. So if she knows every time she comes in that she's going to be feeling good afterwards, it makes my job easier. It basically improves the body's response to needling, and it enhances the effect that any other treatment that she has on her body. So when you watch from the sidelines and see your little pet's age and you see how their body processes are faster than ours and you start to notice any arthritis or cancer or pain, please know that you have other options than Western treatments. You have acupuncture, you have therapeutic laser, you have ultrasound. There's lots of other modalities that we can use. And consider adding these things early in the course of treatment therapy so that way your pet can enjoy every one of those twilight years. Thank you.